I'm going to show you an assessment for the hamstrings. If you have a client who tucks under the pelvis in a squat movement, so they'll be going to a posterior pelvic tilt, then that would indicate tight hamstrings. Now it is normal for that to happen at the bottom of the squat, but it shouldn't happen until you get towards the point where the thighs are getting near parallel to the ground. If you want to double check to see what's happening, is it a poor squat technique, is it poor stabilisation through the core, or is it tightness in the hamstrings making that pelvis deviate, then we can use this assessment. Normal range of motion would be 70 to 90 degrees range of motion. I'm looking to keep the leg nice and straight. I'm going to put my hand on the side of Chris's pelvis here to actually make sure there's no rotation in the lumbar spine. Otherwise I might just find the pelvis is rotating round, and that's obviously mean that I'm not actually assessing the length of the hamstrings, I'm more just pulling the pelvis around instead. So firm grip, side of the pelvis here, my fingers go around the lumbar spine to the side of it, I can feel what's happening here. I take the foot, I keep the foot pointing vertically. Chris is nice and easy to do this too, he relaxes very easily, but you need to have a client who can relax. If they struggle, just use deep breathing methods, just get them to relax, deep breaths, and you'll start to find they can start dropping tension out. What you're looking for is a change in tension. I can feel there's a certain amount of resting tension in his leg, almost by the weight of the leg. And as I come through the movement, I hit a barrier, called the first tissue barrier, but there's suddenly a change in tension of the leg. Now with Chris, it's pretty good range of motion. It's around about here I feel tension come in, so I can come in and out of that position, and just really make sure you're happy. Definitely through about here. There we go, that's the point. Very significant change in tension just here. At this point the spine is still stable. His range of motion, well this is 90 degrees, through about 70. He's about 65, maybe even 60. He's about 60 odd degrees range of motion there. Now his range of motion should be, I should be able to get to about 70 degrees at least before I hit that range of, or that tissue tension. So it's a little bit tight in his hamstrings. Obviously when doing assessments on the lower limbs or through the body, you are looking at assessing both sides. Remember, your hamstrings attach into the ischium or the ischial tuberosity, the sit bones of the spine. If I have one hamstring a lot tighter than the other, or one group of hamstrings compared to the other, you might find there's an uneven tension on the pelvis that can create deviation. That might be something that contributes towards lower back pain or other muscular imbalances. So, yeah, our clients relax, we increase range of motion, 70 to 90 is desirable. So Chris, a little bit tight there today. We would do some stretching with you and we'll work on his range of motion to improve that. So that's our assessment for the hamstrings.